it is really justifying what we do. When we talk about treating cancers, it's always a multidisciplinary approach, right? So it should always be that when you get the diagnosis of cancer, your doctor should basically present your case to surgeons, radiation, chemotherapy doctors, all the support staff, as well, because it should never be one dimensional in your approach, right? So our challenge as radiation oncologists, a lot of times we're not the ones who make the diagnosis. So a lot of times we have to justify using radiation or not in certain situations. So as a radiation oncologist, I really try to stay up on all the studies that are done, both from the past and also currently, to make sure that I still stay up on the cutting edge, because we can never stay stagnant in treating cancer. We should always keep trying to find the next best thing to help patients. And that's what I feel like with protons, that is the next evolution of how we can do better for patients. Surgeons, they do better by now doing robotic surgery, right? So they don't have their hands in patients. They have these little, basically fingers and prods and things like that are robotically controlled, so they're steady. They cut less, damage less tissue. Same with what we're trying to do is hurt less tissue. They're trying to damage less tissue physically when they go after this. And now with the chemotherapy or medical oncology doctors, they are using targeted therapies where they actually not just trying to poison the body, which is what chemo usually does, but they're using immunotherapy where they're directing drugs only at the cancer cells and really minimizing any exposure to the other things. So I think all of medicine is really trying to improve that kind of therapeutic ratio, which means maximizing cure, minimizing side effects. And that, I think, is where we're going with things.